to look her up. She had a TikTok channel. She was also a TikToker, Rachel Tussey, Tussey. And she had a pretty good following from what I remember. But apparently, the surgery went fine. It took a really long time from some of the comments that I read. It normally takes about, 4, maybe 5 hours. And they didn't come and get her husband to come and see her until 10 hours later. So she went in at, I think he said they took her back at 7:30, and it was after 5 when they came to tell him that he could come back, that she was done. So I don't know if something happened that prolonged that surgery, if there was a complication, without having access to her medical records and reading everything that was documented. It's kind of hard to really tell what happened. But he believes that she was overdosed. Now, there's a lot of talk about the medications that she was given after the surgery. So she was given fentanyl, which, number one, you need to understand that that is medical grade fentanyl. And she was given Dilaudid. Now, he says that she was given 0.5 of Dilaudid and 150 what we call mics or micrograms of fentanyl. Now, if you are fresh out of a surgery like that, that's, depending on your weight and your tolerance level, it's not an exorbitant amount of pain medication, not for the kind of surgery that she had. I personally have been given 2 milligrams of Dilaudid and 4 milligrams of Dilaudid, a couple of different times that I was in the hospital. 0.5 of Dilaudid is a half of a milligram. So that is not a lot. 150 mics of fentanyl, it's not an exorbitant amount. He was talking to her, and she recognized him, and the nurse came in to check on her pain level. She said, I wanted to check and see how your pain level is, because I just gave you some pain medication a little bit ago. I want to check on that. And apparently she said she was fine. The husband walked around from one side of the bed to the other and just happened to really look at her and see that her color wasn't really right. She was really white. Which, when he said that kind of leads me to believe maybe there was extensive hemorrhaging during the surgery. But then he noticed that she was kind of turning blue. And so anyway, he got the attention of the nurse. The nurse came in, did a sternal rub, and that's where they take their knuckles and they rub on your sternum really, really hard. If you've never had that done before, it's quite painful. And if someone is, trying to lose consciousness, it's usually enough that it will make them open their eyes. So they did sternal rub. It did nothing for her. The nurse grabbed an ambu bag, the mask that goes over the face, and it's got the bag, and they push air into your lungs. And he said that she gave it a couple of pushes, and she put the bag down and she walked out. And she went to get some Narcan. She came back and she gave Narcan. Well, that didn't work either. So that tells me that apparently it wasn't the narcotics that was causing whatever was going on to happen. Now, again, I can't read the chart. The nurse could have way overdosed her, but based on what was ordered, okay, if this had been the narcotics, the Narcan should have woken her up. The Narcan didn't work. In the husband's video, he says that the mask, the first time that she gave the couple of pushes of air, that he didn't think that the mask was sealed around her nose or mouth. But she left again, went out into the hallway to tell the nurse to call the surgeon back. Now, the surgeon had gone home. Apparently, they were the last case of the day. There was no one else there. The place was pretty much empty except for a cleaning crew. And So there was no doctor on site at all. But what gets me, y'all, is the fact that this nurse panicked. And at the very least, when the Narcan didn't work, she should have immediately started CPR and had another nurse or the husband call 911 to get an ambulance there. That should have been the very first phone call that was made, not calling the doctor. You want to get EMS in or on their way as soon as possible and get CPR started. Now, a couple of things could have happened. She may not have been getting enough oxygen. Now, if she was given an overdose of narcotics, narcotics can depress your central nervous system, which will also decrease your oxygen intake. Now, if she had not been getting enough oxygen over an extended period of time, that could also lead to brain anoxia. And you don't have to just stop getting oxygen altogether. It can be, she may have been getting 70% or, lower than that over an extended period of time. And so that could have happened. And then you would think that they would have the little pulse ox thing on her finger. Makes me think of E.T., that little thing. It's usually got a red light. And they put it on your finger and it tells them how much oxygen you're getting. Excuse me. He doesn't say, the husband doesn't say in his video whether or not that was ongoing. She also could have had a fat embolism or a blood clot, a blood embolism, given the type of surgery that she had. But anyway, the doctor got there, called 911. They got her to the hospital. She was intubated. And at that point, they pretty much said she was brain dead. However, the husband did decide to go ahead and take her off of life support. And the last update that I saw, she was still breathing on her own. Now, she is in a vegetative state. But what that tells me is that there is some kind of brain activity somewhere in her brainstem, or she would not be breathing on her own. Is she going to ever wake up? Probably not. And that is the saddest thing, is that her body is still alive. Now, yes, I've worked in hospice, and I do know that hearing is the last sense to go. Studies have shown. Whether she can hear people talking and she understands what's going on, who knows, y'all. But to be still alive and not able to open your eyes or communicate or move or have any kind of semblance to being alive is a total nightmare. And now this husband has to decide on, does he want to do feeding tubes? Does he want IV fluids? You would hate to think that your loved one is laying there starving to death, until her body just absolutely gives out. But things like this happen, and if you're going to have a surgery like this, I would elect to do it in a hospital. Yes, it costs more money. I don't know if the doctor should have stayed. If there was not another doctor in the building, I feel like he should have stayed, given that he had just done such an extensive surgery that we don't know if there was a complication or not, because apparently the husband was not told anything, but the surgery did go about twice as long as it really should have. Personally, I believe he's negligent for not having stayed to ensure that she was going to be okay. The nurse is definitely liable for not, she panicked, and I get it, but there's a reason why she's working in a surgery center and not in a hospital, and that's all I'm going to say about that. The first thing you want to do is start CPR on somebody who, if their lips are turning blue, it does not take a rocket scientist to know that that patient needs air. And that is the first thing that you take care of, and the most important thing next to getting 911 called. And she had other people around her to make the phone call. She had other people to assist her with CPR. And I feel like this should have never happened. It's a really, really sad story. So apparently I talked too long and my phone stopped recording. So anyway, check out her TikTok channel. She does have videos leading up to that. She was recording her progress and preparing for that surgery day. And she was really excited but nervous at the same time. And then she recorded one last video before they took her back for surgery. And then that was the last video she ever made. So anyway, guys, I hope you enjoyed the video. I hope you go check out the story. And then I will be back in the next few days with a life update for myself. And I will see you guys on the next one. Bye, y'all.